One of the skills you may be asked to perform when you take your state exam is to provide mouth care to a client who has teeth. The client who has his or her natural teeth is lying in bed and needs mouth care. The role of the resident client is played by a person. The checkpoints the state evaluator will use to evaluate your performance are listed at the end of this video demonstration. Greet the client, address them by name, and introduce yourself. Explain the procedure by speaking clearly, slowly, and directly, maintaining face-to-face contact whenever possible, and ask client about personal preferences. Provide privacy with a curtain, screen, or door. Put on clean gloves. Assist resident client to a sitting position in bed by raising head of bed and using pillows as needed to position resident upright at 60 to 90 degrees before offering fluid or brushing teeth. Place clothing protector across chest before providing mouth care. Moisten toothbrush with water and apply toothpaste to toothbrush. Brush sides and biting surfaces of teeth and the gum line with a gentle motion. Offer resident cup of water to rinse mouth after brushing. Hold emesis basin or disposable cup to chin to use for spitting. Wipe resident client's mouth dry and remove clothing protector. Place soiled linens in linen container. Make sure signaling device is within reach and bed is in low position. After rinsing toothbrush, empty rinse and dry basin. Place basin and toothbrush in designated dirty supply area. Dispose of trash and leave overbed table dry. Wash your hands before performing your next skill or at the end of your last skill. Skill checkpoints. Does the candidate. Greet resident, address by name, and introduce self. Provide explanations to resident about care before beginning and during care. Assist resident to sitting position in bed by raising head of bed and using pillows as needed to position resident upright at 60 to 90 degrees before offering fluid or brushing teeth. Protect resident's clothing before providing mouth care and remove protective cover when care completed. Moisten toothbrush with water and apply toothpaste before brushing teeth. Wear gloves when brushing resident's teeth and wear gloves throughout mouth care, including when rinsing basin and toothbrush. Rinse sides of biting surfaces of teeth and the gum line with a gentle motion. Offer resident cup of water to rinse mouth after brushing. Provide resident an emesis basin or disposable cup to use for spitting as needed, such as after rinsing mouth. Leave area around resident's mouth clean and dry when care completed. Complete skill having rinsed, dried, and stored basin, placing soiled linens in hamper, disposing of trash, and leaving overbed table dry. Ask resident about preferences during care. Use standard precautions and infection control measures when providing care. Ask resident about comfort or needs during care or before care completed. Promote residents' rights during care. Promote resident safety during care.